Okay, now next let's talk about the visits and logistics. So the things you want to get done before your chemotherapy appointment. Okay, so first thing is, if you need to see a dentist, if you haven't seen your dentist in a while, or you need some implants or procedures, now is a good time to go get your dental visit done before your chemotherapy. And the reason for that is, once you start getting your chemotherapy and your counts start to go down, by counts I mean your white blood cell count, then it increases the risk for infection. So that's why it's better to get your cleaning and treatments done beforehand. Also, when you're at your dentist, you can ask your dentist about oral care while getting your chemotherapy, so that you can have good oral hygiene and avoid any mouth sores or any other issues with your mouth. The other thing is, it's a good time to go see your PCP, so which is your primary care doctor, about any tests, any diagnostics, and just overall general checkup, so you're ready and you know how to take care of yourself, addressing any other health issues you might have. So if you're getting your treatment and you have for example diabetes or high blood pressure, try to get those things addressed so that your health conditions are well managed, and then you can get your chemotherapy on schedule, because you don't want any other issues complicating your treatment and causing any delays, right? The other thing is, if you need to get your pap smear, visit your gynecologist, then now is a good time. And the reason is, some of the chemotherapy treatments can impact the result of the pap smear. So it can give false abnormal results, which is why it's good to get your pap smears done beforehand if you need to get it done. Also, when you're there, do talk to your gynecologist about your fertility options, if that's something you have not discussed, or even with your oncologist, if you're thinking about getting pregnant or considering it in the future, then discuss those options beforehand, so you know what you can do about it. Usually during chemotherapy, it's recommended to not be pregnant, because it can affect the health of the fetus, but you can consider what can be done afterwards. Does it impact your sexual health in any way? And if you need to consider using sperm bank or freezing your eggs and things like that. So good time to think about and address those things. Okay. The fourth thing is, if the chemotherapy you're getting might affect your hair, if you might be getting hair loss, then now is a good time to look at wigs. And you might wonder why I have all my hair right now. So again, if it's only if you think your chemo generally affects your hair, then this is something to think about. And the reason is because, yes, now you have all your hair and you know what looks good, so you can look at wigs that match your hair color, that match the hairstyle you like. You can take your wig to the hairstylist and have it cut the way you have your hair right now. Also, I encourage you to try different wigs, try different hairstyles, and see if you want to have fun with it. And the other thing with wigs is, a lot of times there are, through the American Cancer Society or other non-profit groups, you might be able to get a free wig, or you might be able to get a discount on wigs. So you can start looking at that if you like. and think about your work routine. So based on how your chemotherapy is going to affect your health and your fatigue, you can think about how much work you can really do, what's going to be your capacity. So thinking about those and discussing those with your family and your supervisor, so that you feel ready and it doesn't cause you stress after the treatment. The other thing is thinking about logistics. So for example, logistics. So for example, child care. If you have kids, who's going to help with picking up kids, dropping them, or helping with the homework. You might be tired. Who might be able to drive you to and from your treatment, if your treatment is something where you're getting a medication that makes you sleepy or it causes fatigue, and if you're going to need help with preparing meals, things like that. So it's a good time to talk about those, talking to your family about how you might feel and what they can expect, and how they can help you okay. And the other important thing to look at is also your insurance. So how you're going to whether your treatment is covered and to what extent, what's covered, and what kind of resources are available for you. So those are some of the things to think about on getting ready before you go for your appointment, so that you're prepared.